Heart Month. Women, you need to know about heart health. Cardiovascular Experts is sponsoring this segment to share important heart health information. Dr. Raj Dave is president and CEO. Can you tell us the risk of heart disease when it comes to women?
So in February, we celebrate Heart Month, and it's important for women to understand their cardiovascular risk. And the most important reason is that there are more women dying from cardiac disease than from cancer. So that's the key factor that makes us talk about how important it is for women to understand what their cardiovascular risk is.
When you say heart disease, what conditions are you referring to?
So cardiovascular disease is a compendium of different conditions. Heart disease is just one of their conditions. Heart attack, for example, is one of the most important conditions. Vascular disease, PAD, or peripheral arterial disease, high blood pressure, all of these conditions are part of the cardiovascular disease then that can lead to a heart condition that women should be aware of.
Of course, we all should care about our heart health, right? Everybody. But in your opinion, why should women pay special attention to their heart health risks?
It's important because women's symptoms of heart disease can be different than men. So if you look at the general population and the understanding of the heart disease, everyone thinks that if you are having a chest pain, then you are having a heart attack and go to the emergency room. In women, a significant percentage of them can have different symptoms such as fatigue, shortness of breath, vomiting, nausea, neck pain, jaw pain, arm pain. So that's why it's important for women to understand what their symptoms can be, because they are different than men.
It seems a little unfair. It seems like those symptoms for women can mimic a lot of different things.
It certainly can. And that's the reason why it's important for them to seek medical attention and get screened for it.
Very good. And I understand you have some helpful information on your website.
Yeah, we certainly have an entire page for women and heart disease on our website, which is cardiovascularexperts.com. It's very easy to understand, and our phone number is there. We certainly can answer questions for them as well.
Very good. Now you're going to stay with us because after the break, we're actually going to hear from one of your patients.
Thank you.
Okay, we'll be right back. Before the break, Dr. Raj Dave educated us about women and heart health. Now we hear from a woman who experienced care for her heart. Cardiovascular Experts is sponsoring this segment. Dr. Raj Dave is again with us. Lisa Campbell now joins us too. Lisa, tell us what happened to you.
I got off work and I started having symptoms in my jaw, my arm, and my chest, and I'm like, this is not normal. And I actually called my sister, who works for Dr. Dave, that I think it was a heart attack, and she's like, yes, you have all the signs, go to the hospital.
So that, I'm sure, was a surprise to you, having a heart attack. Nobody expects that to happen. How did that change your life?
It set light on me that how quickly they can happen and the different symptoms that I had, but many people probably wouldn't realize unless you are aware of your own body.
Yes, and really aware of those symptoms too. Like you said, jaw pain. That is not a hard pain in your chest.
Right. That was the weird part, you know. Jaw, I mean, just everything happened in a matter of moments. No warning, just all happened. And
what would your advice be to other women?
Have yourself checked by your doctor, if you know, cardiologist, to make sure that you don't have a strong history of heart issues. Unfortunately, I do with my family. Mm-hmm. So, but you know, and that's why I was negligent in getting it done. I'm like, no, it's only happened to men. So, but it also happens to women, and we want to brush it off and say we're stronger than what we actually are.
Sure.
So you follow through, and then just do exactly what the doctor says, and everything should be fine.
Well, speaking of the doctor, how can any patient really contact cardiovascular experts?
Yeah, so they can certainly go onto our website, which is cardiovascularexperts.com, and they can certainly call our office. We see a lot of women for cardiovascular screening, and then there's also a lot of helpful information on our website that they can read and see if they have an elevated risk, and if they have elevated risk, they should be checked.
Very good. Thank you to both of you. Thank you for sharing your story with us.
Oh, thank you.
Before we go to break, we want to thank cardiovascular experts for sponsoring the previous segments. We'll be right back.